Thank you all for joining us for the Strategic Evidence-Based Healthcare Leadership Panel discussion in recognition of International Women's Day. My name is Tina Fahim. I'm an implementation scientist at the Knowledge Translation Program at Unity Health Toronto and an assistant professor at the University of Toronto Dalla Lana School of Public Health. I'll be acting as the moderator for today's session. Women remain underrepresented in healthcare leadership roles despite constituting the large majority of the healthcare workforce. This disparity persists despite evidence that shows the positive impact of female leadership on health outcomes, innovation, financial performance, risk and stability, and organizational culture. And despite increased advocacy for more women leaders in global health leadership, the progress has been slow. In recent months, we further observed a retreat on efforts to promote diversity, equity, and inclusion, including programs to increase the representation of women, particularly diverse women in positions of leadership. And as one of our panelists, Dr. Clark, highlighted in the BMJ, the arguments that there are not enough qualified women to fill healthcare leadership roles and the prejudicious stereotype that men deliver better leadership, particularly in times of crisis, has been consistently debunked by powerful research evidence. And now is the time to translate this evidence into practice. We've assembled this panel today to discuss the impact of women-led evidence-based leadership in healthcare. Our panelists include Dr. Jocalyn Clark, who is the international editor of the BMJ and adjunct professor at the University of Toronto. Dr. Clark will discuss women-led leadership from a global perspective and how to best address the challenges that we face in today's current context. We'll then hear from Dr. Martha Maznevski, who is the Professor of Organizational Behavior and Faculty Director for Executive Education at the Ivey Business School, Western University. Dr. Maznevski will discuss her innovative research on how gender differences in leadership impact policies and outcomes. We'll then hear from Dr. Verna Liu, who is the Provost and Vice President Academic and Professor of Pediatrics, Division of Pediatric Nephrology, Faculty of Medicine and Dentistry at the University of Alberta. Dr. Yu will discuss leadership from a health systems and an academic perspective. And finally, we'll hear from Dr. Marie-Josée Hebert, who is the chair of the Canadian Institutes of Health Research's Governing Council and VP of Research, Discovery, Creation, and Innovation at the Université de Montréal. Dr. Hebert will speak about leadership from a research and funding perspective in this political climate. So each of our panelists will speak, and then we'll open it up for discussion and audience Q&A. Following this, Dr. Sharon Strauss, who is the Executive Vice President, Clinical and Chief Medical Officer at Unity Health Toronto, will close out our panel. So just a couple of quick housekeeping items before we begin. Please submit any questions you have for our panelists using the chat box. You can also submit your questions anonymously if you wish. If relevant, please indicate which panel member you're directing your question to. And thank you to all those who submitted questions in advance. We'll do our best to cover as many as we can, and anything we can't get to, we'll compile for a list for hopefully future sessions. And just a reminder that we'll be recording today's session, and we'll make this recording available in the coming days. Finally, we will send out an evaluation following today's session, mostly to hear about other topics you're interested in for future sessions. So with that, I'd like to invite our first panelist, Dr. Clark, to speak.
Thank you, Tina, for that wonderful introduction. And just thank you to the organizers so much for including me in what I'm sure is going to be a fantastic session. I am based in the UK, but I am so grateful to be a member of this amazing community of Canadian women in health and so many amazing health leaders that are inspiring. So I appreciate you all, and I'm so grateful to be here. So just to start, I thought it would be worth mentioning why, as a journal editor, I'm interested in this topic and what my sort of entry point is. And that's because women have been vastly underrepresented in journals as authors, as reviewers, as editors. And I've spent much of my 20+ year career as a medical journal editor consumed by trying to make the literature more inclusive of women, particularly women from diverse backgrounds. But of course, journals exist within a knowledge ecosystem, along with two other major players, academic institutions, research institutions, and funders. And that ecosystem, we are highly interdependent. And so if gender bias exists in one part of that system, it impacts negatively on women's participation and ability to advance in the other parts of the system. And equally, the ways that we can overcome and try to tackle some of the gender bias within our parts of the system, we can then create a more virtuous cycle so that we can advance women's participation. So I'm very pleased that there are representatives from both research and funding on this panel today. The second reason why I'm so interested in this topic, of course, is because as a journal editor, I care very, very much about evidence. And as Tina was mentioning, there is an accumulating body of evidence that women are very effective as leaders, particularly in health. And there is a new, I think, very important piece of global evidence that was recently published that I'd like to talk about for a few minutes. I wrote an editorial, as Tina said, to elevate and amplify this piece of evidence. And I called it the business case for women's leadership. I didn't want to write it that way, which I'll explain in a minute. But the reason I did is because what Rosemary Morgan, also a Canadian based at Hopkins, and her team did was assemble the latest and greatest global evidence on women's effectiveness at leaders. They looked across nations, they looked across sectors, and they assembled the findings of 137 studies to show that women leaders were associated with better financial performance, innovation, ethical practice, health, organizational culture, and women leaders helped other women advance in their careers. I find this powerful to elevate and amplify. It was published in the BMJ Global Health, so it's an open access journal, because assembling the evidence in this kind of comprehensive way, in this sort of systematic way, is really a powerful way that we can marshal our arguments for why women's leadership is important. It's a huge task, of course, to assemble the literature in this way. So I sort of see this as a one-stop shop that can be marshaled and utilized in really important ways to advance what could be seen as a business case for why women ought to be included in larger numbers to advance the performance, the effectiveness of organizations and institutions. The reason that I didn't love doing that is because actually I find the rights-based case for women's leadership in health and beyond much more compelling. Women around the world have the right to participate fully in societies and in public life. Women have the right to equal participation in decision-making systems. Those rights are enshrined in international treaties. They are protected by the treaties that all the member states of the United Nations signed. Those rights are protected. And in fact, they were enshrined and agreed now 30 years ago. 2025 is the anniversary of the Beijing Platform for Action, which created a kind of global blueprint for governments that had committed to women's right to gender equality. And those progresses on gender equality, in fact, are being debated starting this week in New York at the United Nations. But of course, globally, women's rights and women's status and women's health are being threatened worldwide. There's been a great backlash of rights. We've seen this come into stark reality with the re-election of Donald Trump and the ways that women's, particularly sexual and reproductive health and rights, have been stripped away. And I think that that kind of conservatism and that kind of restriction and pulling back of women's rights is very much gaining traction globally. And I think for this audience and as Canadians, we have to actually be quite mindful of the ways in which rights backsliding, may have an imprint on our own country. If we think, for example, just within medicine, where equal numbers of men and women enter medical school and graduate from medical school. Actually, there is a substantial gender pay gap in Canada within medicine. There are also, I think, among our now 18 accredited medical schools across the country, just 2 or 3 of those deans are now women, which is very disappointing. And also, when the UN Women issued their report last week in advance of International Women's Day, they reported that 1/4 of the countries in the world have had a backlash against women's right to gender equality. Well, who was among those 35 countries but Canada? So we need to be really mindful of these broader threats against women's rights and status, which are, of course, the foundation to women's ability to advance as leaders. We need to be mindful of that, not rest on our laurels, and consider the fact that we need to mobilize really important advocacy and evidence towards women's leadership in Canada. So that's my message to the group, and I look forward to conversation and questions, that we know our audiences, that we be prepared, whether it's a business case, a rights case, whether we want to lean into social justice, whether we want to see our performance in a global light. We need to be prepared. We mustn't ignore the larger threats towards women's rights. And we very much, particularly those of us who have had the privilege to be able to gather today to discuss these issues, to use our privilege and our advantages to advocate for women everywhere. Thank you.
Thank you so much, Dr. Clark, and I think a fantastic way to lay the foundation for the panel. I'll now invite Dr. Maznevski to speak.
Thank you. And thank you also for inviting me and for having me be here with this great group. I am at a business school, so I'm a professor at a business school, which doesn't mean we just look at business. We actually look across sectors, but of course, healthcare is not our main focus. I study leadership and collaboration, especially looking at how we can enable and empower unique perspectives. And as part of that, I've often through my career looked at gender and the specific gifts that women and men bring to leadership that are different, and also looking at systemic discrimination through that. I also do a lot of leadership development, particularly for senior leaders, and I've led leadership development programs specifically for women for over 20 years globally, as well as here in Canada. So it's a topic I'm super interested in. And actually today, this is a nice segue, because today I'm going to focus on the results of a recent study on women CEOs in Ontario hospitals that is a good news story for this. It's a study that was initiated and sponsored by Proximity Institute here in Ontario. It's the charitable organization that enables effective senior leadership in Ontario hospitals. And they noticed a couple of years ago that 52% of Ontario hospital CEOs are women. And they thought, well, that's interesting. That sounds unusual. What does it mean for how they developed, how they engage with their leadership and their boards? What does it mean for developing pipelines and future leaders? What can we learn from this group? And so they worked with us in a study conducted by my PhD student, who's now Dr. Ryan Miller, and co-supervised by Professor Alison Conrad here, who's a global expert on research on women in leadership. So we really were able to take a deep look at this. And I'm just going to share a couple of highlights right now about what we learned about this unique group, this unique study. And then we can come back to more of it later. But one of the main highlights we learned focused on the relationship between agentic and communal leadership. So these are two different leadership styles. It's a simplification, like any simplification is, so it's not entirely accurate, but it's a really helpful generalization of a couple of different leadership styles. So agentic leadership is very goal-focused, bottom line, clear roles and boundaries. We get it done, and I tell you, and we're very clear about getting it done. Communal leadership is a different style that's very relationship-focused. It's about building communities. It's got much more fluid roles and boundaries, and the idea is that we build together. Now, these are not necessarily mutually exclusive, but often leaders as individuals and organizations focus on one more than the other. Now, there are two important things behind this. One is a gender association. Men tend to be more agentic, course, there are always exceptions, but in general, men are socialized to be more agentic, and there are probably also biological drivers there as well. Women tend to be more communal. Again, both women are socialized to be more communal, and there are probably also biological drivers as well. So we've got communal and agentic women, men, but we've also got the complication of leader association. People in general, both men and women, tend to think of agentic as leader and communal as not leader. Okay, and that, of course, creates a real bind for women leaders, and including some complexities that I won't get into now, but again, we can come back later if it's of interest. In fact, of course, really good leadership requires a little bit of both, and good leaders do both, whether they're men or women. The way they go about it, though, tends to be different. Men tend to learn communal after they've proven themselves with agentic. Women are often not recognized as leaders early in their career because their strengths are communal. So they have to put it on top. So we kind of had that as part of the background for this study. And then Ryan interviewed 30 women CEOs in Ontario. And we learned a lot about how they lead. The focus was on how they became a CEO and how they managed the CEO role. But through the interviews, which lasted on average close to an hour, we learned a lot about their leadership as well. We found that on average, the women CEOs are very communal in their leadership. We also learned that on average, they did not think of themselves as leaders until they were in very senior positions. They just tended to think of themselves as doing what needed to be done, stepping in where they needed to step in and helping out. At some point along the way, these women recognized in themselves a leader identity. At some point, they said, oh, I am a leader. And at that point, we found that they gave themselves permission to also integrate agentic behaviors. Okay? And even then, they still tended to shield it with communal. So they'd say, we need to achieve this. We have to get it done. We did it. But still, it became agentic within that. So we appreciated being able to study this because it's very hard to see this pattern without a study like this. And when we do see it as a pattern, we can develop all kinds of implications for policy, for development, for how we support women leaders to achieve the kinds of outcomes that Dr. Clark was talking about. So I'll just leave it there, and I look forward to the rest of the conversation. Thank you.
Thank you so much. And I think so helpful to have that framework, as one of the goals of today's panel was really to focus about what are the solutions, what should we be doing going forward. So I think that those pieces of evidence are really going to be great to inform our upcoming discussion. Next, I'll invite Dr. Verna Yu to speak.
Yeah, thanks very much. And ditto, I'm very honored to be part of this wonderful panel and to be speaking with all of you today. And I just thought I would start by just reminding us of sort of where we came from as women clinicians. Dr. Emily Stowe was actually the first female physician in Canada. Born in 1831, she started off as a school teacher, tried to become a principal, had to quit because there was something called the marriage bar law, which is that once they got married, they had to give up their jobs. Then she decided to go into medicine, got rejected, managed to get into medical school in New York, came back to Canada, tried to practice, had to go back to medical school because she didn't get in the first time in Canada, and really didn't get her license till 13 years after she graduated because of all of this. And I think what she's left with us is that not only was she the first female physician in Canada, her daughter also became a physician. And really, she led the way for us. Now 115 years later, we are much more prominent, but we know that there's also a lot that has to be done. I just thought what I would do is just sort of share some experiences with you. You've heard a lot of really great information from Jocalyn and Martha. Just really appreciated all their comments. I just wanted to start off by sort of talk a bit about my experience in academic leadership, as well as in sort of health system leadership, and how I got to sort of both. And I just share with you the first time that I actually ventured into the dean's office in faculty of medicine and dentistry at the U of A was actually more or less by accident, or was non-intentional. I think that's probably another theme you might have heard, Martha, when you interviewed women. And it was because when I first saw the job description for the assistant dean for student affairs, I actually threw it in the garbage right away because I was batting 0 for 3 in my mind. I was not male, I did not have white hair, and I was not Caucasian. And it wasn't until somebody tapped my shoulder that I thought, well, maybe I could do this job. I was doing a lot of work with medical students. Maybe I should get some credit. Threw my hat in the ring, got the job. And the phone call that I got was probably one of those pivotal moments in my own career where, as you said, Martha, I finally owned my own competency. And in the phone call with the dean at that time, he said, Verna, good job on your interview. I'm so pleased to offer you the job. And my first response to him was, I'm so lucky. Again, it's one of those things that women tend to do, is luck. It wasn't because I was competent. And he said to me, Verna, good people make their own luck. And I've never, ever forgotten that, because at that point, I sort of thought, maybe that's correct. Maybe it wasn't luck that I got to where I was. And, fast forward, took the job. I eventually became the interim dean of the faculty. And I was one of probably the best years of leadership I've had. But, in the conference room, in the dean's conference room, I am one female out of about 12 males, all Caucasian, all older, again, with white hair. And, I still have women come to me say, Verna, when seeing your picture on the wall shows us what's possible. And I think a lot of it is sort of trailblazing and really making sure that women can see other women in leadership roles. When I actually went on to Alberta Health Services, into the health system, and became their president and CEO for 6 years, that was about 5 years longer than the average half-life of a CEO at Alberta Health Services. I think the average half-life was about 12 months. But I think one of the things that early on happened when I was asked to step in as interim, you'll notice I've done a lot of interim roles, which is another common feature for women leaders. But as I stepped into the interim role for president and CEO, one of the things I actually said to the board chair at that time was that I actually don't want this job. And the reason why I said that was because I had never seen it be successful. Remember, the average life of a CEO at that time was 12 months. So why would I take on that job, knowing that it's only going to be temporary? And I didn't want to do a job unless I knew I was successful in the job. And I think that's another feature for women who choose leadership roles, is that we have to be sure that we're successful, whereas for men, they just throw their hat in the ring. Doesn't matter if they're successful or not, doesn't matter whether they've got the skills or not. For women, we tend to be wanting to be sure that no matter what we do it well, and that we're going to be good at what we're doing. And so it's really around, I would say, making sure that we don't always have blinders on as to what we're capable of. I can tell you that when I stepped in as the interim dean for the faculty of medicine and dentistry, I actually did not think that I could do a job like that. I knew I was very focused. I could do my job well. I was very granular in my thinking. And it was almost like being challenged with things that are outside of your own perspective of yourself, and understanding that, maybe I should challenge myself. And maybe I shouldn't always adhere to what I think I'm capable of, but maybe listen to people as to what they think you're capable of. Happy to obviously share more stories with you, but with that, I'll pass on the baton over to the next speaker, and back over to you, Christine.
Thank you so much. And I think lots to come back to for our discussion there. And our final panelist, I'll invite Dr. Hebert to speak now.
So thank you, Tina, and also thanks to Sharon for the invitation. It really is a pleasure and an honor to be with you today. And so in this, like the coming 5 minutes, I'd like to focus on two statements. First question, why we need women in leadership. So I'd like to convince you all and convince ourselves that we need women in leadership role and in health research because we need women to fulfill our mission in science and health research. And we cannot do that if we don't have bright male and female scientists and health professionals in leadership roles. And this was somewhat alluded to by Martha. Because we bring something different that is this diversity, but this multifaceted model that we want to create depends on having a diverse cadre of individuals in leadership roles, and therefore we need women. And I will share with you some, I hope, compelling examples of what it can provide to the country, not only for ourselves individually, but for the whole population of Canada or globally. And my second statement would be, why don't we have enough women in leadership roles where there might be external factors? You all think about, biases and discrimination, but there might be intrapersonal factors, and Verna alluded to that we also need to be mindful of if we want to promote actions that will have a true impact into enticing, but also keeping and fostering leadership roles for women. So I'll start by wearing my CIHR hat and refer to the CIHR Act. Because as you know, CIHR was launched at the turn of the century with a specific objective of putting science at the service of the Canadian population and have an impact on the health of the Canadian population. And it is really stated, this objective within the Act. So, quote, the objective of the CIHR is to excel according to internationally accepted standards of scientific excellence in the creation of new knowledge and its translation into improved health for Canadians. So we could say for the Canadian population. So half of the Canadian population is composed of women. So we shouldn't aim at improving the health of half of the population. We need to make sure that we have a comprehensive vision and action, mobilize knowledge towards the whole population. And that implies doing good science that takes into consideration all major factors that will have an impact either on knowledge production or translation. So I would like to pay tribute to one of our scientific director at CIHR, Kara Tannenbaum, who played a great, a pivotal role in having us all in Canada consider sex and gender in our research programs. And we all knew it was important. All of us clinicians know that there are differences between men and women, yet few of us systematically made sure that our research programs involved consideration of sex and gender. And one very compelling example is cardiovascular disease. The development of many of the knowledge that we gained and even the understanding of clinical conditions was gathered largely from male-only cohorts. And in the 70s, 80s, and 90s, we considered that, it should be the same in women. But this ignorance led us to misdiagnose and not treat appropriately half of the global population. We now know that the natural history, the clinical presentation of cardiovascular disease in women and males are different. And so I believe that my key message there is considering sex and gender as only doing good science. But it does take leaders to bring their own experience, expertise, and personal lived expertise and experience to the table for us collectively to be able to, develop this multifaceted a program that is needed for good science. So I guess, and Jocalyn alluded to that, there's abundant evidence that female leadership is good for an organization. So why don't we have enough women in leadership roles in health and health research? But globally, why don't we have enough women in leadership roles, not only in health? And there are external factors, but again, I'd like to draw your attention to what psychologists would call intrapersonal factors. And sometimes, and that has been my experience as Vice President Research at Université de Montréal for the past 10 years, women may be more fully aware or sometimes overestimate the negative impact of the leadership roles. Whereas, and as pointed out by Verna, sometimes men either ignore the negative factors or they don't play a major role in their decision to move forward. And so that has been very nicely substantiated in a great paper that was published 10 years ago in PNAS by a group at Harvard Business School. So the lead author was Francisca Gino, but it still applies. It has been in various surveys demonstrated that women do have this tendency to either overestimate or anticipate the negative impacts of leadership roles. So as leaders, how do we make sure that even if they are fully aware of the pros and cons, that they still move forward? Well, I guess that, voicing why we need them for the good of the organization, why they make a difference, and making sure that collectively boards, other leaders, are fully aware of the added value and the difference that female leaders bring to the organization is one of the solutions to making sure that not only do we convince them to speak up, but also see themselves as leaders, but have the freedom and the will to develop their own leadership styles, whether communal or both, but making sure that they feel confident and they understand the added value that they can provide to any organization. So I'll leave you with that, and I'll be looking forward to our discussion.
Thank you so much. And I'm just going to jump right in. We already have questions coming in. So at this time, I'll invite all of our attendees to submit questions in the chat box. But I'd like to start by asking each of you to comment on how do we overcome some of the challenges that face women in leadership positions? How do we keep focused on forward momentum of success? And in particular, if you have examples from your own work or your own experiences to illustrate either the challenges or ways to overcome them, would really appreciate those. And maybe just to mix things up, we'll start in the order that we'll go backwards in the order of presentation. So I'll ask each of you to comment, starting with Dr. Hebert.
Thank you, Tina. Maybe I'll share one example from my life as a vice president research here at the Université de Montréal. So I've been in the role for 10 years, as I mentioned, and I very often saw differences in the way that female leaders would be speaking up in meetings compared to their male counterparts. And in recent years, I was, reading the literature, but also sharing my experience with fellow vice presidents. And then, and we decided that we would meet with female leaders, and we would ask them, so why is that so? like we know that, you're doing great work, but so why don't you share what you're doing, and why do you remain silent while your male colleagues express themselves? And there were, it was very interesting because there were, various reasons. One was that they didn't need the spotlight, that they want to get things done and they don't need to express themselves collectively to get things done. Another one was about, I don't want trouble. I don't want to place myself in a situation where I have to fight, and I want to be collaborative. And if the discussion is more adversarial, I don't feel that, I should intervene. But then this collective discussion allowed us to actually discuss, well, you may get things done for your own department, faculty, whatever, but we need you for the whole organization. And when you don't speak up, we cannot benefit from your difference, from what you bring, from this different side of leadership. So it's not only getting things done, but it's also influencing the global conversation. And that actually was something that they did not anticipate. They didn't see that as being valued as important. And it changed the dynamics. And now it was funny because the last time we had the meetings, they were all, talking before there or at the same time. And so it really changed the dynamics. So it does show that when you're transparent, when you are clear about, why you need them, but when there is a sense also that it is for common good, then you can actually change the dynamics.
Thank you so much, Dr. Yu.
Maybe I'll just add on to what Marie-Josée was saying, and just with my own personal story around very early on. I'm a pediatric nephrologist, so pediatrics was all I've ever wanted to do. And at that time, it was just right before CARMS was established. So you apply for residencies, and so I was waiting for my pediatric residency interview. And I went twice to the office, and before I knew it, they actually had given out the spots. All male, all Caucasian males. And I did pretty well in medical school. I got really good references. And I was sitting there thinking, well, why did I not even just get an interview, let alone a position offer? And I realized at that point that it wasn't just good enough to be good at what you do. That as women, and I'm also a visible minority, and I also call it an invisible minority, but as women, we actually need to be able to network, to be visible, purposefully visible. And I did not play that game in medical school. As I said, I was naive. I didn't think it was necessary. And so I think one of the big barriers for ourselves is sort of, to Marie-Josée's point, is that we just think if we're there and we do the job, we'll get noticed. No, you won't. And so I've always advised women early on in their careers to be visible, put your hand up, apply for jobs, regardless of whether you get it or not. But just let people know that you're there, that you're interested, that you want to be part of the solution, and you will get noticed. But it takes effort on your own part, and not just to assume that you're good enough at the end of the day. So I'll pass that on, Tina.
Thank you. And Dr. Maznevski, please go ahead.
Yeah, thank you. No, really, really great examples. And for me, it kind of comes down to two categories of ways of helping or overcoming the barriers. And one of them is making it okay for women to be more agentic. And actually, why not training women to be more agentic? It sounds terrible, but if I look at a typical leadership development program, it has an awful lot of communal stuff. I spend an awful lot of time teaching men how to be empathetic. So, you know, why is it not okay to teach women to be agentic or support young women to be agentic and also see that as leadership? I think that's fine. And I think that's related to the first two questions too in the Q&A. The third one too that I just want to add on is I've worked with a lot of organizations through this journey of how do we get more women in our senior management. And the other piece that is crucial is rethinking what leadership is. A little bit of that changed the dynamic, as Marie-Josée was saying. So how do we, and so just for a quick example, looking at your job descriptions, right? And most job descriptions focus on agentic things. How many people will you manage? What's your budget size? And you know, what level of education do you need? So it focuses on very agentic things. And when you look at what a job actually is, no matter what it is, but especially senior leadership in healthcare, there are a lot of communal requirements too. They just tend not to be written down as often. And so even just writing down the job description in ways that are both agentic and communal, right, can shift that. And the beautiful thing that I've seen happen in many organizations, and Marie-Josée, you just gave an example of it too, is when you have that discussion, it changes the perceptions of leadership for everybody. And it actually empowers a lot more men to bring out their communal side as well. And you get a much broader and healthier definition and leadership culture in general. So for sure, I agree 100% with Verna. Women need to become comfortable being agentic, and we need to encourage women to be agentic. I focus more on courage than confidence. I find it's actually not very helpful to try and develop confidence, because the more you try and develop confidence, the less you have. But courage in spite of confidence is very healthy and helpful. So on the one hand, and then on the other hand, helping in the environment with very specific things to redefine leadership to include communal, even at lower levels of the organization. And it makes leadership better for everybody.
Thank you so much. And Dr. Clark.
Yeah, it's brilliant. Really interesting to hear the others' suggestions and examples. So I'd like to complement some of that more kind of individual level advice with, you know, a kind of approach that I bring to how to elevate and grow future leaders. And that is more around fixing the system rather than fix women, which I'm sure all of us have had the experience in our, you know, various leadership training programs and the ways in which our institutions are trying to grow us up and try to support us. It does tend to be in the form of individual level kind of development that asks women to change how they are in order to fit a system that is very coded male. So let me just offer you a few things that I've come to learn over the years. And some of this was reflected in the previous conversations, particularly Verna's experience of being the only woman around a table. I mean, most of the evidence shows that until there's a critical mass of women or of people of color, those groups and individuals will feel marginalized. And it's difficult in those circumstances when there isn't critical mass, you know, to raise your hand, to put your neck out, to expose yourself as different. And so one of the ways that we can get to critical mass, there's great evidence for things like quotas. I know it's, you know, a very debated issue. But it is something we could argue for. I mean, certainly we see that happening in things like panels or conference arrangements. We no longer do all male panels, for example. I would expect all of us in our institutions. So quotas are a structural or institutional tool to get us to critical mass, which will completely transform an institution. The other ways that we fix the system or try to change institutional environments so that they're more conducive and supportive of women in all their variety of leadership styles is naturally, because the monopoly of leadership and power within institution lies with men, that we make male leaders more accountable for change. So it's not just, we have over 100 people here today. I would imagine most of them are women, that this is not just the job of women to create transformative change, to make all our organizations and institutions fit for the future, but that this is in everyone's best interest, but also it's everyone's responsibility. And so to bake into institutional leaders who are currently mostly men, that they're accountable to creating institutional environments that are very accommodating of difference. The flip side of that, which Martha just articulated so beautifully, is that then it allows men to express their leadership across a whole spectrum of masculine behaviors, because that kind of diversity is really, really important. Transparency, introducing more transparency into our organizations can really favor inclusion. And it's one way to drive accountability, particularly around pay gaps between men and women. And also just one final point, which is something I always say, particularly to the young women around me, is that what we see in front of us as models of effective leadership, or, you know, the effective leader in a pandemic or a crisis, these are constructions. They're social constructions. They are made up. Somebody made them up. They're not inevitable. That means that they can be changed. So this kind of notion that a certain type of leader needs to be the dean of medicine at the University of Toronto or the Secretary General of the United Nations, these are social cultural constructions, and that means that they can change. So the more women that we advance, they can express the kind of leadership that we need in our organizations to be effective, which is much more diverse, much more inclusive, and much more transformative than we currently have. But women don't need to change themselves in order to achieve that. The systems and the male leaders, unfortunately, need to change. And that's, I hope, what we can press for.
Thank you so much. And you've all touched on a lot of the questions that have come in. Quickly putting on my qualitative hat, I would say a few of the questions are around, you know, how do we prepare women individually, but then also the systems piece. And I think we've touched on both. Another question we have in the chat here is around sponsorship and mentorship. And the question says, sponsorship is a key driver of career advancement, yet Black women are often faced barriers in accessing influential sponsors. As a woman leader looking for concrete steps, can you recommend anything? And I'll open it up, just free discussion for whoever wants to respond. So Marie-Josée and then Verna.
Yeah, rapidly. So I'll actually go back to some comments from Martha and Jocalyn also, because I think that we shouldn't be, so mentoring individually is incredibly important, but making sure that we train the system. And we shouldn't neglect like training boards, you know, because this is, the expectations comes from the highest. So having good governance, good membership, but making sure that you train and transparent processes. But after that, making sure that those, that like the governance, the processes are aligned with your values, that those are clearly communicated, and that you lead by example, including from your board. And that means that the board will understand that if you want to develop a more resilient organization, therefore you want to have a diversified membership at board level, but within your organization. But you want also to develop means of valuing that, making sure that everybody understand that it's a priority, and it's a priority because it's good for everyone. You know, it's not like having more women in leadership is not only good for women, it's good for everyone. So I guess that it would become less difficult if you're training at the various levels, but making sure also that while you're training, you make sure that you align your values, your governance, and your processes. And I guess that it's this is something that, we have seen at Université de Montréal. Our chancellor is a Black entrepreneur, and he's been through a lot of life experience, which has benefited our organizational conversation. And so, and changed some of our processes. So I believe that you need to, at each and every level, including the individual level, make sure that you are, open, aware, and supportive, but never neglect the top, never neglect governance, and never neglect processes.
So Tina, maybe I'll just say that I think for the sponsorship piece, it's a really important aspect for women. And I think the onus is for all of us, no matter what role in, to actually take part in the sponsorship. But the other thing I just want to highlight that is not just from women leaders or from other women. Actually, male sponsorship is even more critical in many respects for all the reasons that have been pointed out. And I can say on a personal note, some of my strongest sponsors and mentors have been male, and they've been just tremendous sort of in helping. The other thing I just want to highlight just before, because I know we're close to an end, is, the evidence is really, really important. There's no question about that. And, all the articles that have been linked to this talk, I hope everyone has a chance to read it, because I think it's really powerful data. And Martha, your paper, just fascinating. But as important as the evidence is the narrative and the storytelling. I live in Alberta, where, as you can imagine, evidence doesn't get you very far. And so it is really important that we also complement the evidence with the narratives and the stories that may resonate to a different faction of people versus the data, because as academics, we only reach to a certain audience. And really, we have to have more of a sense of the public storytelling that will actually show the importance of women leaders and the difference that women are continuing to do for society. So I just wanted to say, yes, process, governance, all of that is really important, but as important is that we need to go out and be bold about telling our story in a different way.
Sorry, I was on mute. Thank you all so much. We have about 7 minutes left. Perhaps as a closing question before I hand over to Dr. Strauss to close out the panel, could you each comment on what you'd like to see in healthcare leadership 5 years from now? And again, really focusing on those concrete actions, be it at the system level, process level, individual empowerment. Like, what do you think we should be doing, promoting, doing in our own lives? And what would you like to see happen? And we can go in whatever order. Maybe Dr. Clark, I'll ask you to speak first here.
Thanks. This has been great. I've just loved being a part of this. So thank you again. I got one thing on my wish list for you. In 5 years, I'd like to see every healthcare leader in our country, in Canada and in Britain, where I live, be accountable to the ways in which they've increased diversity and inclusion within their organization. So their board, their senior management team, and the teams below them. And I want their job and their remuneration, their bonus, and the renewal of their contract to be contingent upon the ways that they have created diverse and inclusive workplaces.
Thank you. Dr. Maznevski?
Yeah, it's such a big question. And I like that answer too, Jocalyn. I think something that I'm working on in this leadership, but also just more generally looking across sectors in leadership, I would like to see more collaborative leadership. So leaders working together across organizations. We need to have different organizations because they specialize in delivering different kinds of value to whoever they're delivering value to. But now more than ever in the history of humanity, we need those different organizations working together. And I particularly see that in the healthcare sector with the community organizations, the pharmaceutical organizations, all of the different organizations need to work together, and that requires more shared leadership. So I would like to see more communal in leadership in general, and see it validated and see it valued as well as validated, and really see it kind of a little bit related to the last question we got there about willingness of men to share power. I know a lot of men who lead well communally as well. So I would like to see that valued and validated across systems.
Thank you. Dr. Yu?
I'll just share a quick story. I mentor a young woman who is a very accomplished health systems leader, just completed her MBA. And she was called recently by someone within the Alberta healthcare landscape to step in an associate role. It's a position that actually would be considered as demotion. The person who called in even actually know her CV, didn't know what she contributed. And she actually was thinking about whether she should take the role or not. And this is where, you know, in our sort of pre-discussions, this is where my comment came out, you know, stop picking up the crumbs. As women, we have to stop picking up the crumbs where others are not willing to fill in the gap. So in 5 years' time, I hope women understand what where their courage is. Martha, I love that concept of courage, but I also believe it is confidence, that you do have to have a certain level of self-confidence and courage in order for us to be able to know that we should not be taking seconds, that we should be going for gold here, and 5 years that women would continue to espouse that type of belief.
Thank you. And Dr. Hebert?
I guess my aspirations align a lot with what you all mentioned, but specifically what Martha mentioned about more collaborative and communal leadership. I'm convinced that we need more of that. But I'm also convinced that, and I would hope in 5 years from now, that we globally recognize that diversity is necessary for excellence and resilience, and that we value diversity as an ingredient that is good not only for people with markers of diversity, it's good for all.
Thank you so much. And I will note that there's been a lot of fantastic articles and resources mentioned. We will compile all of these and send around a reading list alongside the recording. And with that, I'll invite Dr. Strauss to close out the panel for today.
Great. Thanks so much, Tina. And thanks to the fantastic panelists and our amazing moderator today. In this time of chaos and darkness in the world, they all shine brightly as brilliant leaders with integrity, with compassion, and with commitment to their values. And I thank each of you for participating today. Their words today really highlighted successful evidence-based leadership strategies that we can all implement, such as focusing, as Martha said, on building courage and developing agentic leadership skills. And they also outlined that we, and in particular, wanted to focus on those of us with privilege, need to keep pushing to achieve equity in leadership across all sectors. We are stronger together, and we will face the future together with courage, using the robust evidence base that we all spoke about today to affect change and remove barriers for others. Now, many of you know that this session actually arose because a lot of us are feeling anger. We're feeling sadness with what's going on in the world right now. And in particular, as Jocalyn mentioned, with the threats to equity and inclusion. And I call on all of us today who are here to use that anger, to use that sadness that many of us feel, and to push forward together, to persist with courage, and together we'll be successful. Thank you all for joining us, and back to you, Tina.
Thank you so much. I think that's a fantastic place to leave it. Really, really sincerely thank the amazing panelists. Thank you, Sharon, for organizing this. And thank you all for attending. Hopefully there's more to come. So please send your questions, please complete the feedback, and we will be in touch with resources in the coming days. So thank you all so much and have a great afternoon.
Thanks so much.
Thanks, everybody.
Thanks, everyone. Bye.